so normally we would cater for as many persons as possible, but because of the observation of the pandemic protocols, this year, majority of our audience will be joining online. Welcome also to our online audience. And for the few persons that are here, feel welcome. And of course, throughout the day, remember, today is a learning occasion, right? So whatever questions you have, feel free, post it in the chat, or of course you can just indicate by raising your hand. Alright, so first let's talk about the urine. Alright, what is urine? Alright, so many times we might want to say, I want to urinate or I want to pee. Yes, we are relating to that same clear, transparent, amber-colored fluid, which of course is a waste product made in the kidneys, right? Alright, so out of curiosity though, what is in our urine? Wouldn't you want to know what's in your urine? Alright, so in our urine we have water and other dissolved chemicals that also contain urea, which is formed from protein breakdown, and creatinine, which is formed from muscle breakdown. Alright, so if these amounts are not within a normal range, or if other substances are present, it may be a sign of a certain disease or condition. Alright, so now we know what our urine is and what our urine is made up of. What is a urine analysis? Alright, so a urine analysis would actually be a group of chemical, physical, and microscopic tests of the urine, and this is done in order to detect and or measure several substances in our urines, such as waste and other products of excretion, which is both normal and abnormal metabolism of cells, cellular fragments, and bacteria. Alright, so now we know what is urine and what our urine contains. Let's talk a little bit at how this urine analysis test is done. The patient is given the urine specimen container, properly named and dated with date of birth as well, to go ahead and pass their sample of urine. The patient is also advised of the procedure to go ahead and pass the urine as it relates to allowing the first portion of the urine to go into the toilet and then collect the midstream without stopping. In addition, the patient is also advised to allow the remaining to pass off as well.
Good afternoon, everyone, those in the audience and on my online platform. I am Kaci, Hudson. I am a member of the urine analysis lab team, and I'm here to discuss with you the various urine specimens that we can use to detect disorders or infections in the body. Now, the first morning specimen, as the name suggests, is the first urine collected for a patient when the patient wakes. Alright? So the preferred specimen, it is the preferred specimen used for pregnancy testing and obtaining like various harmful bacteria in the body. A sterile container is used, labeled with the patient's information, such as the name, the age, etc. And it's given to the patient to collect their urine when they wake. Now, the patient, or you should advise the patient to not contaminate the container. Alright, so the other type of urine specimen is the clean catch specimen. Also, people refer to this as midstream specimen, right? The aim is to obtain the urine from the middle of the bladder. This is done by passing some urine into the toilet and then the rest, the middle part of the urine into the sterile container, then the rest into the toilet. Patients are advised to wash their hands thoroughly to avoid contamination. Uncircumcised males should retract their foreskin to clean around the urethral meatus. Women should separate their labia with their fingers because the aim is to obtain the urine specimen from the middle of the bladder. So, the other type of urine specimen is the 24-hour specimen. otherwise called timed specimen. This specimen is mostly taken to test to see how much creatinine clears through the kidneys. A sterile labeled 1 gallon container is provided to the patient where all urine after the first flushed urine must be saved. Alright? So the last urine specimen must be collected exactly 24 hours after the first specimen. Some urine tests require that the 24-hour specimen is refrigerated during collection. As soon as the 24-hour period is over, the specimen is brought to the lab for testing. Just to recap, we spoke about the various urine specimens and how they are collected. Thank you.
Good day, everyone. My name is Kenelia Dell, and I'm a part of the urine analysis lab team, and I'll be speaking to you on the specific urine gravity. Now, what is the specific urine gravity? The specific urine gravity is a test that shows the concentration of all chemical particles in the urine. It measures the density of urine to the density of water in the urine. So it's a test to show how well your kidneys are functioning or how well they're diluting your urine. Now, with the specific urine gravity, it can be either high or low. So when you have a high specific urine gravity now, it means that your urine is concentrated. And when your urine is concentrated, that could be based on a number of reasons. Now, one of those reasons is that you're not having enough water or enough fluid in your diet, so your urine becomes concentrated. Now, that may be because you're losing a lot of fluid, whether through vomiting or diarrhea or sweating. Now, there are certain conditions that are related to you having a high specific gravity, and those are hepatorenal syndrome, dehydration, heart failure, stroke, and renal arteriosclerosis. Now we'll be moving on to low specific urine gravity. What does that mean? Now, when you have a low specific urine gravity, it simply means that your urine isn't concentrated enough. Now, if your urine isn't concentrated enough, it means that your urine is too diluted. So, when your urine is too diluted now, it could mean that you have a rare medical condition called diabetes insipidus. Now, with that condition, you will be thirsty constantly and you'll be excreting a large amount of diluted urine. Now, with low specific urine gravity, you have conditions that are associated with them, abnormal conditions. And I'll be listing a few of those for you. So that could be because of renal failure, malignant hypertension, phenylonephritis, psychogenic polydipsia, and glomerulonephritis. Now, how is this test done? How do you do a test for specific urine gravity? Well, no worries, it is nothing heavy, it is just a simple, quick test. Now, with that test, you will have to give a specimen. Now, a specimen, this is when you collect your urine in a container, and then when you do that, now you give that to the healthcare provider who will then do the test. So, what is used to do this test is a dipstick. When that is dipped to the urine specimen, the color change on the dipstick now, that is what will indicate to a person or to the healthcare provider the specific urine gravity or the gravity of the urine. So now that test, it only gives a rough result. So if it is picked up that you have something in your urine, something which may seem abnormal, now they will do a sample and then they will bring that to the laboratory for another testing or laboratory testing, whether it is a microscopic testing or so. Now, the normal range of specific gravity urine for a normal person, it ranges from 1.005 to 1.030. So that is the normal range. Anything beyond or below that, then it is abnormal. Now, when a patient will be doing such a test, there are certain preparations that must take place. Now, one of such is that the healthcare provider may ask the patient to stop taking certain medications. Now, medications that contains dextran, intravenous dyes, and sucrose, those medications you'll be asked to stop taking them before you do the test. There are also certain foods that you cannot eat as they will change the color of the urine. So foods like beets, blackberries, carrots, fava beans, and rhubarb, those your doctor or your healthcare provider will tell you that you must not eat those before you do a test. So that is it for specific urine gravity. I hope you learned something. So yes, thank you.
Hello, ladies and gentlemen, those in the audience, those on the online platform. Today I will be discussing about ketones, a term that many may not be familiar with, as well as some may be familiar with. So we're going to talk about what are ketones. So ketones are usually chemicals produced in the liver. So if the body is not producing enough insulin, this leads to a buildup of glucose in the blood. When this occurs, ketones are formed in the blood and then spilled into the urine. So high levels of ketones in the urine would indicate the presence of diabetic ketoacidosis, which is a diabetic complication which can lead to coma or even death. So it is normal for small amounts of ketone to be in the urine, such as 3 milligrams to 15 milligrams. However, abnormalities would include the range from small to large, which small being less than 30 milligrams per deciliter, moderate being 30 to 40 milligrams per deciliter, and large being greater than 80 milligrams per deciliter. So persons with ketoacidosis may experience fever, burns, metabolic disorders, eating disorders, or consistent vomiting. So for persons who have been tested positive for high levels of ketones in their urine, it is advised that they do regular blood sugar tests, and also they should remain hydrated via water, which is the ideal fluid, which has no calorie. Also, one more very important thing to note is that you should not do any strenuous activities or exercises, as this may increase the levels of ketones in your urine. Now, your healthcare provider may recommend you to do a ketone test if you are diabetic or have symptoms of ketoacidosis. And these symptoms would include abdominal pain, trouble breathing, frequent urination, as well as type 1 diabetic persons are also at risk. Now, in preparing the patient should ensure that they do not eat any meal or drink anything, as well as do not take any medication, as this may interfere with the results. The test is done with the usual dipstick and urine sample, and based on the dipstick, you can match it back with the tube, the color scheme, to determine if your levels of ketones are high or it's okay. Okay, thank you for listening. I hope you are well informed, and if you have any questions, feel free to go in the email or contact us by our numbers, which will be provided on the various platforms. So we have a very important guest today, and she is from one of our branches, who will be talking to us about protein and glucose in the urine.
Good afternoon, everyone. As my colleague said earlier, my name is Nurse Tarasue Ebanks. I am from the head office, and I'll be speaking to you today on proteins in the urine. Okay, so let me go ahead and discuss. So normally, healthy persons don't really have proteins in their urine. It's normally found in blood, right? So if it is found in urine, it's normally called proteinuria, right? And no healthy person should have proteins in their urine. So you must be wondering, what are some of the causes for protein in urine, right? So you have kidney problems, it could be heart failure, could be UTI, could be problems even during pregnancies, could be multiple other problems as well. But for now, we will stick with those. Normally when you go to the doctor and they test for urine and stuff, the protein, the one that we normally test for the most is albumin, right? So in the urine, albumin normally should be between 0 to 20. Because remember we said that no healthy person should have protein in their urine. So it should be between 0 to 20 milligrams per deciliter. If protein is detected in the urine, then you would see it's going between 0 to 20 or 0 to 14 milligrams per deciliter. It depends. So as my colleague had said earlier, after the dipstick has been placed into the urine for 30 seconds, we will go ahead and match the dipstick to the colors on the tube. So the indicator on the dipstick is tetrabromophenols blue. So the darker the color on the indicator, the more concentrated the urine is with proteins. Doctors may also request 24-hour urine from their patients. So when they return with the 24-hour urine to the doctor, they will send it off to the lab for analysis. The normal range for proteins found in a 24-hour urine should be 80 milligrams per deciliter. So if the protein in urine is at a very high concentration, then that will be considered as microalbumin. So what the doctor normally does is that they can request a random sample, that's just random peeing, or they can also send you home for 24-hour urine to bring back. So when those samples come back to the doctor, they will send it off to the lab for analysis. And it comes back, the results come back to the doctor. If it is 30 milligrams, it's considered normal. If it's less than 30, considered normal also. If it is between 30 and 300 milligrams, then it is considered microalbumin. But it may indicate that you have early kidney disease. If it is more than 300 milligrams, then it will definitely indicate that you have kidney disease. So, you must be wondering, what are some of the causes, or what are some of the signs we'll be seeing if you have microalbumin? You have fever, blood in urine, or it could be a UTI, or you're not drinking enough water, which causes dehydration, and several other factors. So what we normally recommend is that you just get your checkups regularly. Please, I am begging you, get checkups regularly so you can know what's happening in your body. So now on to glucose. So glucose is normally found in the blood. If it is found in the urine, then that means there are some underlying conditions in which your kidneys are damaged or your blood glucose level is too high. So you must be wondering, what are some of the causes for glucose to be in your urine? Well, there are two such causes. It could be that insulin is not transporting glucose into your cells properly, or it's not producing, the body isn't producing enough glucose to counteract the high levels of glucose in the blood. So if glucose is found in your urine, it is known as glycosuria or glucosuria. So the normal range for glucose in your blood should be between 0 to 15. That's the normal range. If it is more than 15, then we know that it could lead to other problems. Maybe you have diabetes or other conditions, maybe hypertension or something else. What they would normally do, as I stated before, they would match it against the two colors to indicate the presence of glucose or not. If you're seeing a light green color on your lipstick, when you match it, it would indicate that you have glucose in your urine, but it is within a normal range. If you're seeing a yellow color for glucose, it would indicate that it is negative. No glucose is found in your urine. If the concentration for glucose is high in your urine, it would indicate that the colors would move from light green to a dark purple. So, as I stated earlier, it is best if you can get checkups regularly. Getting checkups regularly to ensure that your body functions are working perfectly and they are in normal conditions. You can also buy the test kit. Buy the test kit and test it on yourselves. Thank you so much for having me today, and I hope you all will be doing, as I said before, getting regular checkups. Thank you so much.
I just want to say a special thanks to everyone who made today possible in our educational forum, from those who are here in our midst, to our online platform. Welcome everyone. Special thanks as well to our members here at the Urine Analysis Lab and other branches. Special thanks to our guest speaker that was with us today, to give a word. Special thank you to everyone actually who made today possible, and we look forward to seeing you in our other forums. Thank you.